now we come the rest part of the pleura, parietal pleura. So here this one is the mediastinal pleura, which lies on the side of the mediastinum, and we can say it lines the lateral part of the mediastinum. It has three parts. The part which lies above the hilum or root of the lung. So this one is this part lies above the root of the lung, and another part which lies at the root of the lung, and the rest part which lies below the root of the lung. So there are three parts of the mediastinal pleura. Above the root of the lung, it extends from the lateral part of the sternum in front and behind up to the lateral portion of the vertebral body. Okay, so it forms a transverse slit from the sternum behind up to the vertebral body. At the root of the lung or at the hilum, it goes laterally. Here we can see it goes laterally, and it continues or covered the root of the lung. Okay, and here it continues with the pulmonary pleura or visceral pleura. Below the root of the lung, the portion of the mediastinal pleura, here we can see it forms a double layer fold. The bilaminar fold of the mediastinal pleura is known as the pulmonary ligament. So here the pulmonary ligament, it contains a few amounts of the areolar tissue and the lymphatics, and which allow the movement of the pulmonary vein. Okay, we know the venous wall is very thin. During exercise, increased venous return occur, and at that time, here it poses a dead space, and which dead space allow the expansion of the pulmonary vein during exercise, and it also allow the movement of the root of the lung. Okay, so these are the function of the pulmonary ligament, and here at the margin and the tubular sheet at the hilum, here the two layer of the pleura, that is pulmonary and parietal pleura, is continuous with each other at the margin, but below the hilum, here only the mediastinal pleura forms this pulmonary ligament. Here there is another figure of the pulmonary ligament. It's made up of the mediastinal pleura. Okay, part of the parietal pleura. This is the pulmonary ligament, and which allow the movement of the pulmonary vein here, the lower pulmonary, inferior pulmonary vein, and also allow the movement of the root of the lung. So this is all about the parts of the pleura. Now the pleural reflection. So what does it mean? The area of the pleural reflection, here this is the area of the pleural reflection. So the area of the pleural reflection on the diaphragm, here on the diaphragm and on the mediastinum, the space between the parietal and visceral pleura are greatly expanded. Okay, so the area of the pleural reflection, here the area of the pleural reflection, here the pleural of the pleural reflection on the diaphragm and the mediastinum. Here the space between the pleura, that is parietal and visceral pleura, that is pleural cavity, is greatly expanded. Here we can see here it is greatly expanded, and here also. This expanded portion of the pleural cavity is known as the pleural recess. Okay. So here we can see a recess in between the, here the outer one is the costal pleura and the inner one is the diaphragmatic pleura. So this name of the recess is the costodiaphragmatic recess. Okay, here and here along this line, here the costal pleura, and on the medial side there is mediastinal pleura. So this recess is known as the costomediastinal recess. Here we can see this is the costomediastinal recess. Here is another figure. Here in this portion, this is the diaphragmatic pleura and this one is the costal pleura. So here it is greatly expanded in between the visceral and the parietal pleura. This pleural cavity is greatly expanded, and this portion is known as as it is formed between the costal and diaphragmatic pleura, so this is known as the costodiaphragmatic recess. And here we can see a figure, and which is formed between here the mediastinal pleura and here the costal pleura. Here the pleural cavity is greatly expanded between the visceral and the parietal pleura, so this recess is known as the costomediastinal recess of pleura. Among these two recesses, the costodiaphragmatic recess of the pleura is the most dependent part of the pleural cavity, because any collection is first accumulated here. Here we can see the costodiaphragmatic recess. So this recess situated along the mid axillary line. Here the axilla, so along the mid axillary line it extends from the 8th rib up to the 10th rib. Okay, it extends from the 8th rib to the 10th rib along the mid axillary line. And now come to the costomediastinal recess. Here the costomediastinal recess on the right lung, it is occupied by the anterior border of the right lung. Okay, and on the left lung it is larger due to presence of the cardiac notch. Here this is the cardiac notch of the left lung, so here the costomediastinal recess is larger, and it is confirmed by the percussion on the lung. If we percuss over the left lung where the lung tissue present, there the sound is resonant because of presence of the ear and the lung tissue. This sound is resonant. Where if we passes at the site of the cardiac notch, here the sound is changed from the resonance to the dull because of absence of the lung tissue here. So this is known as the superficial cardiac dullness. Clear? So what is the function of the costomediastinal recess? It provides the space to the anterior border of the lung during inspiration. Now the extension of the lungs and the pleura. Here it is the picture of the lower border of the lung. Here the outer margin is the visceral pleura, green color, and the slaty color is the lung tissue. Okay, so this one is the lower margin of the lung, and this one is the pleura, parietal pleura. So now come this line. This is actually the mid clavicular line, and this line is the mid axillary line, and this is along the scapular line. Okay, so along the mid clavicular line, the lung extend, lower margin of the lung extend up to the 6th rib, and along the mid axillary line it is extend up to the 8th rib, and along the scapular line it is extend up to the 10th rib. Here we can see the extension of the pleura. It is a distance 2 ribs below. We can see here 8, 10 and the 12 along the mid clavicular, mid axillary and scapular line. From this picture we can see here the lower margin of the lung along the mid clavicular line 6, along the mid axillary line 8 rib, and on the posterior aspect along the scapular line, this one is the scapula. It is lies along the 10th rib, the lower margin of the lung, and the pleura is 2 ribs below here, the 8, then and 10, and then here the lower margin of the pleura along the 12 rib. Now come to the basic difference between the parietal pleura and the visceral pleura. We know parietal pleura lines the thoracic wall and the mediastinum as well, and the visceral pleura lines the surface of the lung. Okay. Parietal pleura, as it lies towards the soma or body wall, so we can say it is developed from somatopleuric layer of the mesoderm. And the visceral pleura, it is developed from the splanchno or viscera. Okay, it is developed from the splanchno-pleuric layer of lateral plate mesoderm. Now the nerve supply, the parietal pleura, as it is lying the soma or body wall, so it is innervated by the somatic nerve, and the visceral pleura, as it lies towards the viscera, so it is supplied by the autonomic nerve like that of the viscera. Okay, so somatic nerve is pain sensitive. So parietal pleura is pain sensitive and the autonomic nerve is pain insensitive. Okay, and now come to the blood supply and the lymphatic drainage. The parietal pleura is same of that of the thoracic wall, and the visceral pleura is same of that of the lungs or viscera. So the nerve supply of the parietal pleura, it is somatic nerve, and then we can see the here the costal pleura, costal pleura, and the peripheral part of the diaphragmatic pleura. Okay, this is supplied by the intercostal nerve. Okay, as this lies towards the intercostal spaces, so these are the supplied by the intercostal nerve. Now the mediastinal part of the parietal pleura and the central part of the diaphragmatic pleura, these two are supplied by the phrenic nerve, as there is a diaphragm beneath it. So these are the supplied by the phrenic nerve. And the visceral pleura is supplied by autonomic nerve. As we know, this autonomic nerve has a sympathetic and the parasympathetic component. The sympathetic nerve fiber are derived from the thoracic 2 to thoracic 5 segment of spinal nerve, and the parasympathetic, this is most important. Now the referred pain, what does it mean? Referred pain means the pain is originated from one side, but it feels in the other side than its original side. Okay, so there is a question why the pain of the pleura is felt around the neck region as well as in the shoulder, because we know the mediastinal pleura, here we can see the mediastinal pleura and the central part of the diaphragmatic pleura, these are supplied by the phrenic nerve, and we know the root value of the phrenic nerve is from the cervical 3, 4 and 5 segment of the spinal nerve. Okay, and if there is any inflammation in the pleura, that is pleurisy or pleuritis, this pain is felt around the shoulder and in the neck region, because we know due to same segmental innervation, the shoulder and the neck region is supplied by the supraclavicular nerve, and which root value is almost similar to that of the phrenic nerve. That is, the supraclavicular nerve root value is the cervical 4 and 5. Okay, so due to the same segmental innervation of the phrenic nerve as well as the supraclavicular nerve, the pain of the pleura, mediastinal pleura and central part of the diaphragmatic pleura is felt on the neck region. There are 5 sites where the pleura may extend outside the thoracic cage. Okay, so the first site is at the right costosternal joint. Okay, costosternal angle. Here the pleura may extend outside the thoracic cage, and on the either side of the root of the neck, the pleura may extend the outside of the thoracic cage, and at the costovertebral angle, here at the costovertebral angle, the pleura may extend outside the thoracic cage, and this site the pleura can be punctured inadvertently at this site during the surgical procedure. So this 5 site, the pleura may extend outside beyond the thoracic cage. Now the clinical importance. First, pleurisy or pleuritis. What does it mean? We know itis suffix is used for any inflammation. So pleuritis means inflammation of the pleura, usually in the parietal pleura. Okay, and in the parietal pleura, if it is inflamed, the pain may aggravated by the movement, respiratory movement, and the pain is radiate to the thoracic wall and the abdominal wall. Why? Because we know the costal pleura is supplied by the intercostal nerve. We know, and the peripheral part of the diaphragmatic pleura also supplied by the intercostal nerve. So as it is inflammation in the parietal pleura, we know the intercostal nerve is supplied in the thoracic wall and as well in the abdominal, some few portion in the abdominal wall. So the pain is radiate to the abdominal wall and in the thoracic wall. And why the pain is felt during respiratory movement? We know in between the visceral pleura and the parietal pleura, the space is known as the pleural cavity, and it is filled with a few amount of fluid, that is 5 to 10 ml, and which helps to lubricate in between these two layer, and which prevent a friction in between these two layer. But during inflammation, this surface become dry, and this may friction occur here. Okay, and the friction occur here. Due to friction in between these two layer, the pain is felt during inflammation. And this sound, pleural rap, can be heard with the stethoscope. Usually, the inflammation of the pleura occurred by the tuberculosis, that is pulmonary tuberculosis. Now few terms. Hydrothorax, what does it mean? Hydrothorax means, hydro means water. Okay, so hydrothorax means accumulation of fluid, that is serous fluid, into the pleural cavity and between the parietal and visceral layer, this pleural cavity. Accumulation of the serous fluid in the pleural cavity is known as the hydrothorax. And what is the meaning of pneumothorax? Pneumo means ear, so accumulation of the air in the pleural cavity is known as the pneumothorax. Hemothorax means accumulation, hem means blood, so accumulation of the blood in the pleural cavity is known as the hemothorax. And what is pyrothorax? Pyrothorax means accumulation of the pus is known as the pyrothorax. This is also known as the empyema. Now another clinical condition, that is known as pleural effusion. What does it mean? Pleural effusion, we know usually in between the visceral pleura and the parietal pleura 5 to 10 ml of fluid is present to prevent the friction, and it lubricate in between these two layers. If excessive accumulation of the fluid occur here we can see the excessive accumulation of the fluid accumulated in the pleural cavity is known as the pleural effusion. And in pleural effusion, it compresses the lung from the outside, and the breath sound is diminished. And if we percuss on the lung, the sound become dull here because of presence of fluid. Okay, and the sound becomes stony dull. Okay, whereas on the lung, the sound is resonant.